My name is Janice Emanuel McLean, President of APC Community Services. And this afternoon, it's my distinguished privilege to welcome you to the 9th Annual Caribbean Health Summit. Last year, because of the pandemic, we were not able to host this event, but we are so delighted that you joined us this afternoon for this very important program, where we'll be focusing on the impact of COVID-19. To all our community partners, we want to thank you for collaborating with us. And to all our participants, I want to welcome you and trust that this is going to be an informative as well as a transformative experience for you. So welcome one, welcome all. At this time, Ms. Hildegarde Reimers, who is the Secretary of APC and an administrator of BMS, will do the introduction to our keynote speaker.
Good afternoon, everyone. Welcome, Dr. Pierre Arty. So Dr. Pierre Arty is currently a member of the executive staff at Housing Works and holds the position as Chief Psychiatric Officer. Dr. Arty completed a pre-medical concentration in political science at Columbia College of Columbia University. He later attended and received his medical degree from SUNY Downstate Health Science Center at Brooklyn College of Medicine. He is board certified by the American Board of Psychiatry and Neurology and the American Board of Addiction Medicine. In addition, he is a member of the Alpha Omega Alpha Honor Medical Society at SUNY Downstate Medical Center. He has received numerous awards: AMS Outstanding Community Service Award from the Asclepius Medical Society, Executive Directors Award for Services to the Kings County Hospital, Caribbean American Health Care Award in 2018 for his contribution to the health of New Yorkers, the Dr. Philip Breckner's Visionary Clinician Award for his service to the New York City underserved people presented by New York City providers of healthcare for the homeless. Among many of his interests are writing and providing medical care to the world community. He travels to other nations to provide humanitarian care to the underserved. Dr. Arty is the author of the book Life and Death and the Things in Between, published in 2017. He has a strong interest in social justice issues as it relates to medical care. Dr. Pierre Arty.
And I thank you very much, Ms. Reimers, for that wonderful introduction. And it is very good to see you, very good to see everyone. It is an honor to be here this afternoon to present just a certain level of knowledge having to do with psychiatric care during this time. And I must say that it is an honor to be the keynote speaker for this organization. So Dr. McLean, thank you for this invitation. And so without further ado, let us begin. I would like to share my slides now, so give me a moment. So the topic of my presentation, which I think is a very central topic, is, can everyone hear me?
Yes,
Beautiful.
sir. Yes,
Beautiful.
sir. Loud and clear. Yes, we can.
Great. Is wellness for the healthcare provider. This is a very important topic. Well, why is it so very important? Because if you consider what we're going through at this present time, as far as the pandemic, as far as social justice issues, as far as issues having to do with the economy, the political climate in which we are living, we are the ones who are the frontline staff. We are the ones who are guarding the community as far as their medical care, along with their psychiatric and psychological well-being, their emotional care. And we spend a lot of energy doing this. Of course, this is what we're in the business of doing. We care for individuals. We are altruistic. Whatever got us into this business, we want to care for folks. But then you got to wonder, who is caring for you? Who is caring for me? Because what happens is that none of us are made of steel, as my father oftentimes reminds me, and we all have our propensities towards being weak, being hurt, being thirsty, running out of water, being hungry, and just essentially being tired. And so we have to consider our own wellness during this time, and it's a very crisis time. Consider that we have not had a pandemic in the last 100 years. This is the first time that we as a world community are going through this together. So we have to consider wellness for the healthcare provider for us. So it's my utmost pleasure to present this to you. And I have a love of animation. And if anyone knows me, I do like to express my thoughts in terms of metaphors. And I see that in this popular culture, superheroes are a big thing. And so I trust that you guys are familiar with some of these characters that I will present in order to convey my thoughts. Now, take a look at this guy. Those who have seen the Avengers movies can readily identify this individual as Thor, the quote unquote God of Thunder. Let me just share a little bit with you guys. I am originally from Haiti. And when I first came to the country, I did not know a word of English. I had to learn English. And how did I learn English? Well, not so much in school, but buying comic books and going to the library and reading about mythology. And I read a lot about Norse mythology, Greek mythology, African mythology. And this character comes to mind. And the question here is, if you look at these pictures, who is susceptible to mental illness? You know, who is susceptible? Well, I got news for you. We are all susceptible to mental illness because, and if you watch the movies with the Avengers, you will see that this individual who started out in the far, I guess, the far right as a very nice, slim, handsome fellow. This was before he went through his trauma. And when he went through the trauma of having lost his mother, his father, they died. And his only weapon, the hammer, which has been with him throughout all his godly life, was destroyed. And all his friends died because of what he considered that he made a mistake. He allowed himself to just essentially fall apart. He went into a state of critical despair and depression. And this slim fellow just kind of lost control of his life, started drinking alcohol, and became overweight, and just essentially was a picture of clinical depression. And you can see in the picture to the far, I think it's the far left, his face, it focused on his face. This is a man in trauma. This is a man who is hurting. This is a man in pain. And essentially, remember, this is a superhero. This is a superhero, and he's in pain. So you got to wonder, what does it say for you and I? All right, next one. This is a character being played by Robert Downey Jr. He plays the character of Tony Stark, alias Iron Man. I labeled this mental illness and a superhero. In this scene, what happens is that he was speaking with a friend of his, Rhodey, who was his very best friend. And while they were speaking, the conversation went on about an incident that took place in one episode where he nearly died. And a child comes up, says something in his ear, which triggers the memory of his near-death experience. And in the middle of the conversation, he's unable to continue with it. He walks out and goes quickly into his Iron Man suit, which is a very sophisticated piece of technology to analyze what could be going on. Considering he says, I am a superhero, he thinks I'm a superhero, I must be poisoned, or someone is trying to poison me, someone is trying to do something to me. Well, what is going on? So his suit makes the analysis. Jarvis is the suit, and he asks the suit, but what's going on? Am I being poisoned? Is someone doing something to me? Am I undergoing an attack? And Jarvis's response is, my diagnosis is that you're experiencing a severe anxiety attack. And the next scene, which to me is just something precious, his response was, me? I am going through an anxiety attack? I am a superhero. I'm not supposed to go through anxiety attacks. And in the same vein, we can consider ourselves as that superhero, the doctor, the physician, the nurse practitioner, the physician assistant, the mom, the dad, whoever the employee is. You consider yourself that you have capacity, you have resilience, you have strength. But there comes a time when you may look at upon your own self and you say, yeah, me. I may be the one having that anxiety attack. I may be the one undergoing some kind of depressive disorder. I may be the one, because we are all human. So take a look at these these statistics for a moment. Prevalence of any mental illness in the United States, any mental illness, this is from the National Institute of Mental Health. In 2019, there were an estimated 51.5 million adults aged 18 or older in the United States with any mental illness. This number represents approximately 21% of all US adults. What does this say? This means that any mental illness is common, which means that it can affect me, it can affect you. None of us is exempt, okay? No matter if you think of yourself as Superman or Wonder Woman. The prevalence of any mental illness was higher among females, 25% approximately, than among males, which is maybe 16%. And there may be reasons for that. Is this accurate? Is this not? We can go into that. It may be due to culture, and maybe due to the perception that men cannot express themselves in terms of when they are hurting. It may be due to stigma having to do with mental illness, you know, all right. And let's go on, and we see that young people are not exempt. Young people ages 18 to 25 years, they had the highest prevalence of any mental illness, was approximately 29%, compared to adults aged 26 to 49. Okay, so the prevalence of any mental illness was highest among adults reporting two or more races, followed by white adults. The prevalence of any mental illness was lowest among Asian adults. Maybe cultural influences that results in this. But the point that I am making is that in the United States, it is significant that a major portion of the country, 51.5 million adults, approximately 20% of all US adults, in any given time can be susceptible to having a mental illness. Okay, let's go on. So based on these statistics, my question for you as the audience, and even for myself, are you tired? And yeah, to be honest with you, I'll be transparent. I'm tired. I'm tired of this pandemic and other real life issues. I've got my father I'm looking after. I'm tired of the stress that it takes to look after someone, dealing with insurance companies, trying to get approval for this and for that. And then even as I'm looking after my own patients. So you understand, I am tired physically, emotionally, spiritually. And I wonder, are you guys tired? Any one of you, feel free to add in the chat. And it's just important to be transparent and to be open about this. We all have limitations. If you consider what we went through during the events of 2020, the Black Lives Matter movement. This is a picture of me. I was also involved in the protest. None of us are free until all of us are free. I was proudly protesting. Events of 2020. Just 2 weeks ago, if you look at the deaths, I went to the wake of a friend of mine who passed away, even at the tail end of COVID. Okay, we're talking about racial injustice. We're talking about protests taking place. We're talking about the coronavirus, financial issues. And then when you consider politics, we had so much misinformation presented to us last year, and you didn't know who to trust from every level, not pointing fingers at anyone, but federal, state, local. And some of it was intentional, some of it was not, but it was not helpful at all. This is all the stress that we all experience as a nation. So what other stressors can we talk about? Anxiety and fear of infection. When you wake up and you're hearing about these numbers in terms of this percentage died today, that percentage died, that percentage was infected. Yeah, it can build anxiety, fear of infection. You kind of wonder, am I going to be the next one? Is my family member going to be the next one? My brother, my sister, my friend, my spouse, whomever, my partner, are they going to be the next one? So this adds to anxiety, this adds to fear. Daily reports, as I mentioned, of the infections and deaths. The miscommunication, I mentioned, the politics, the overtasked healthcare system. When doctors, physicians, nurses, PAs, nurse practitioners, when they get sick, you're talking about an overtasked healthcare system. When you have an X number of individuals coming in with a lower number of people who are able to take care of them, it really, really, really causes such an imbalance that whoever is left really has much more work to do. Now, consider also being a psychiatrist, I will tell you social isolation does not help us in any way. We are human beings. Our brain is made in such a way that our brains are made in such a way that we need to interact with individuals. This is how children grow. This is how we grow as a community. And so when you have to isolate yourself, you're not in contact with individuals, there's less physical contact, there's less social contact. Well, there's a price to be paid for that. There is a price to be paid. This is the price that we paid during this whole time of the pandemic, all of 2020 and still part of 2021. We're still waiting for New York to open up. From my understanding, from what the governor says, we're at 68.8% in terms of vaccination, and the New York will not open up totally until there is 70%. And even as we're talking about vaccinations and trying to get back to whatever was normal, we have a body of individuals who are protesting or who are pushing back against vaccination for whatever their reasons could be, politics, religion, whatever it may be. So there's a lot of push and pull involved. These are the stresses that we're dealing with. Financial impacts, job loss. Many individuals lost jobs last year. Okay, schools and business closures. I have many friends who are parents, and because of school closures, it caused an extra stress as far as now their home life is turning into school life. Having to homeschool children, having to essentially become more technologically savvy in order for the schooling to take place while the children are not physically at school. Okay, and consider that this causes boundary issues as far as, you know, where does my life begin? Where does my child's school life begin and ends? Where does my own work life begin and ends? Because now everything is taking place at home. How do you adjust that? How do you address that? How do you adjust to that? The issue of systemic racism is something that we can talk about from now until forever. Of course, being a person of color as I am very sensitive to this, and I am knowing of this. But then when you have politicians who blatantly will tell you that this does not exist, it has an impact upon you. You know, it's like a slap in the face. You know, you want to say, no, that's not true. And yet it's being tolerated in the country. So these are all the stresses that we're dealing with. And these are just some, not even all. This is not an all, a full list of the stresses that we're going through. And then there is the vaccine hesitancy, which we as people of color, there is viable and valid reason how come we should be hesitant, or we can be hesitant. But we have to also understand that, you know, in order to save one's life, there are things that we just need to implicitly trust, as far as knowing that there's a death rate involved with having COVID, you know, as opposed to taking a vaccine where should you have COVID, then you'll be less symptomatic. And that's just medicine. That's just a medical issue. That's just science. And so there are still people, you know, who are dealing with vaccine hesitancy, which does not help us in terms of getting to a herd immunity, which would allow us to eventually open up as a nation. All right. So these are just some stressors that we are dealing with. As I mentioned, this is not all that we're dealing with, but there's so much more. And then look at this. What happened? I don't know where you guys were on January 6th, but when I saw this in terms of people just stampeding the Capitol, it was very hard for me to witness. Very hard for me to witness. And I think I developed some vicarious trauma there, because if you consider what happened, where a lot of these folks were allowed to just go home without any apparent immediate consequence, and you consider that people of color have been imprisoned for far less than this, it's such a blatant injustice that it clearly does have an impact on, I think, a person of color living in the United States. So this was very, I think, traumatic for us. And then not just for people of color, not just for Black and brown people, but a lot of others, a lot of white folks who saw this blatant injustice were moved by this. And it was a stressor, absolutely. And these are very, very traumatic pictures that I believe people in government are still dealing with. Some are in denial, but some have been traumatized by this, of course. What other things do I want to share with you today? So the personal effects, this is from this movie called In and Out, I believe, where these characters represented the many different emotions that we all experience. There is the fear, there is anger, there is joy, there is sadness, and then there's anxiety. So all of this are these feelings that are evoked when we are presented with the stressors that we are presented with. So impact on mental health. Let's talk about that a little bit. Doctors, nurses, including me, including many of you, paramedics, working as frontline, we are working, as I mentioned, as frontline force to fight the COVID-19 outbreak. You and I, may be much more susceptible to develop mental health problems. And I don't want to just limit it to the paramedics, the nurses and doctors, but also people involved in clinics who are working in the front desk, who are involved with managing patients who are waiting, who are in the waiting room. All of us may be more susceptible to develop mental health symptoms. Okay, how so? Fear of catching a disease. I don't know about you guys, but throughout the whole pandemic, I was working. And so, yeah, I had a fear of catching the disease. I had a fear of possibly bringing something home. God forbid my father, who is, over 90, should have this illness coming from me. Yes, I had a fear of catching it. Long hours, long working hours. Many of us work extra hours this time. Unavailability of protective gear and supplies. I know many hospitals, Wyckoff Hospital, for example, over here at our clinic at Housing Works, we, of course, made it a point to have protective gear and supplies, but I know many places suffered in terms of lacking these things, okay? The patient load, because the patients are suffering. And so we are not only seeing more patients, but patients with more acuity, much more of a burden of illness. Death of our colleagues after exposure to COVID-19. I'm a SUNY downstate graduate, very happy to have been a SUNY downstate graduate. And I have to say that several of my colleagues who were senior to me as I was doing residency, some who were as I mentioned, seniors, some who were my role models, passed away due to COVID. That had an impact on me. I've already mentioned the social distancing and isolation from our family, from our friends. And so the dire situation of our patients may take a negative toll on our mental health, all right? And this is from the International Journal of Health Plan Management, okay? The working efficiency of health professionals may also be decreased, which means it's how efficient are you working? What is your capacity? Are you able to focus well on the job? Are you able to even rest at night to have the energy to come back to work, to do what you need to do? Maybe decrease gradually as the pandemic, may have decreased gradually as the pandemic continued. Now, the way it's written, it says as the pandemic prevails, because this was back in June of 2020. But now we are in June of 2021. We're at the tail end of this, and we can take a step back and look to see what were the consequences of having gone through this, and what is still the consequence that we are dealing with at this present time. Okay. Now, I got this. Oh, sorry. This quotation from Martin Luther King. It says to keep moving forward. Keep moving forward. But then I wonder, how do we move forward with all of these stresses? And I guess this is, well, not that I guess, but I know this is why we are here today. How do we move forward? According to Martin Luther King, Dr. King says, if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward. And I wholeheartedly agree with that. So how can we move forward? And let's just explore that a little bit. So according to this quotation, it is now widely recognized that indirect exposure to trauma involves an inherent risk of significant emotional, cognitive, behavioral changes in the clinician, which means that you don't have to have been directly exposed to the trauma, but even the indirect exposure to the trauma causes some kind of emotional and cognitive and behavioral changes in you, which may not be for the best. Well, what does this mean? This means that if you take a look at the little picture of two people sitting down and speaking, the things that we as healthcare providers, you could be a psychiatrist, a psychologist, a clinician, involve a licensed clinical social worker, or you can be a medical physician. You can be a PCP, a primary care physician, but your client, your patient may very well share something with you in terms of what they're going through. So expose you to their trauma. And by all means, as a human being, it does something to you. It does something to you. It changes you on an emotional level, on a cognitive level, and even behavioral level. And by cognition, so that we can be on the same page, what I mean by cognition or cognitive is how we take in information, process information, and what we put out. So what we do as clinicians, we take in some level of our client's pain by how we facilitate our sessions with them individually, even group sessions. We listen to their story, okay? We collect that data as part of our efforts to intervene and identify issues. So we're really helping them to put pieces of their lives together, to help them to understand what's going on in their traumatic experience. And so in doing that, it really demands a lot of us. Well, what does it demand? It demands a certain empathy. It demands a certain level of kindness. It demands a certain level of compassion, all right? It demands that from you, and that takes a lot of energy. And so what happens is that we can experience, after a while, what is referred to as compassion fatigue. And what is compassion fatigue? It's the emotional and physical fatigue experienced by professionals due to their chronic use of empathy and helping others in distress. This is a serious issue. It's a serious thing. I have colleagues who tell me that at this present time, they have nothing more to give. And that's when you have to consider the potential for burnout. When you have nothing left in the tank, you're not happy with your position or what you're doing, you have nothing left for you to even feed yourself. And that's compassion fatigue. And that's very real. And we have to be aware of this. So this here says that the most insidious aspect of compassion fatigue, I mean, the worst thing about it is that it attacks the very core of what brings us as helpers into this work, our empathy and our compassion for others. This is not just limited to psychiatric folks, to psychological folks. It's not just limited to those involved in that kind of mental health field. This is for everyone. This is for the mom who has to basically conjure up a sense of compassion towards her children when children are just all over the place because they're now home as opposed to school. Okay, this is also for the frontline desk person who is working in, let's say, a mental health capacity, mental health field, mental health institution, or even a place providing medical help to patients, medical services. It affects every one of us who has to demonstrate a certain level of empathy and compassion for others. We are all susceptible. It's like that picture with Rodney Downey Jr. Who, me? Yeah, you. Yeah, me. Yes, any one of us is susceptible to that. So what makes us susceptible to this is this. And not that this is a course on the dynamics of the mind, but I have to mention something having to do with this concept of the superego, which is an idea that was put out by Freud. Well, all of us called into this business of caring for folks, most likely we have what is referred to as a superego. That is that part of us that is our conscience, that helps us to essentially push us to do good work. Okay, and what happens is that this can work in another way in which we start to have a sense of guilt over what we think we've done or what we haven't done, or maybe we haven't done enough, and a sense of harsh self-criticism. And then we become rough to ourselves and we don't treat ourselves as best as we could. We become our worst critic, actually, giving ourselves the worst critique, okay? That's the superego. And many of us have a very harsh and very punitive type of superego when we don't really need to. Very punitive. So let's go and take a step back and define wellness, because wellness will help us understand how do we move forward. Well, at my job, I am responsible for wellness for or to present on wellness for our facility, for our institution. And I have a committee who actually focused on wellness topics. And we came together and we discussed wellness, and we defined it ourselves. But before even our own definition, we looked at how other people define wellness. And according to the World Health Organization, they define wellness as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So understand, it's not just the absence of something or the absence of a malady or something bad. It is the presence or the state of complete physical, mental, and social well-being. That is wellness. And we, in our wellness committee here at Housing Works, we define wellness as practicing habits that promote health and fostering an environment that would lead people to thrive, not just to survive, but to thrive, okay? And practicing these habits that promote health. Well, and we're not being judgmental in terms of practicing good habits or bad habits, but we're saying practicing habits that promote health and fostering that type of environment. That means that we have to learn what these habits are. The National Wellness Institute defined wellness as a conscious, self-directed and evolving process of achieving full potential. So there is a journey here. There is a place where we're going in terms of achieving our full potential. And I don't believe personally that anyone ever totally, arrives, but you continue with the journey, and it's an evolving process. Okay, it's an evolving process, and it's very conscious. Conscious meaning self-directed, meaning it's intentional. It's intentional. So there is a sense of responsibility that one has to take to gather certain information in order to apply that information to improve one's life as you walk on this journey in achieving full potential. Okay, let's move on. So now let's talk about strategies for wellness, for well-being. Okay, and in the play by Shakespeare, he says something having to do with to know oneself, taking personal inventory. I strongly believe in that. I strongly believe in that. Knowing oneself is very important. Knowing what your limitations are. Knowing that, hey, you know what? I may be better working in the morning than working late at night. So maybe I may do my best work in the morning, or maybe I do my best work at nighttime. But knowing yourself enough to know when you are at your best is important. So you have to take personal inventory. Well, what is, knowing what your limitations are. If you know that you have to eat 3 times a day, and if you don't function well, then by all means do so. If you know that you can function on 2 meals a day, then by all means, because everyone is different, do so. If you know that you need 7 hours of sleep, and without that you start to not behave well, then by all means, you have to know your limitations, understand yourself well enough, what your triggers are, what the triggers are not, and how to present yourself as the best person you can be day to day. That takes intention. That takes, again, personal inventory. Eating well, sleeping well, and exercising well. Recently, we had a presentation here having to do with plant-based dieting, in terms of not taking meat completely out of your diet, but the benefits of knowing that, the benefits of plant-based dieting. There are many benefits that you can attain from that, from appropriate nutrition. So eating well, going hungry during the day, not eating all day long. I know I may be preaching to myself here, but that's not a good thing. We can talk about sleep all day long, the importance of it. Sleep is rejuvenating. Sleep is replenishing. Sleep just brings you to a place where your resources are once again being built up. And so you have to consider, getting good amount of sleep. We need that. These are the things, these are very basic things, by the way, in terms of strategies for well-being. And exercising is very well, whatever your capacity is, however you can. I started running since last year throughout the whole pandemic. Thankfully, I've been able to continue an exercise program because I needed that in order to function every day. As I mentioned to you, throughout the pandemic, I was working every day. People needed me and I needed to be my best self. So I needed to keep myself well enough. Exploring your spirituality, and I'm not talking about exploring your religion now, but in terms of your connection with whom you believe to be the higher being or power greater than yourself. And spirituality is such a big umbrella that you can basically put many things in there in terms of practicing it. Is your practice include meditation? Is it writing? Is it singing? However way you may define worship, but exploring one's spirituality, knowing that you are more than just this flesh that you're wrapped in. If you would cater to that belief, envisioning the big picture. Well, what is the big picture? That you are not just for yourself, but there is a big picture out there in terms of the help that you're providing individuals and the impact of your help. And that help is not just limited to one individual, but then that flows over into the individual's collateral, as far as family, as far as friends, neighbors, and so forth. You're making a big impact. Understand that you're doing a big thing and appreciate yourself for that. This is something that I think all of us, the next one, that we all can benefit from in terms of taking breaks without guilt. Sometimes we are so driven with that super ego driving us to continue to move forward and do this and do that. I've been involved in some religious circles where they say, I want to, burn for Christ, so I'm working for the Lord. And people get so tired and they're almost ashamed to take a break, just to reward themselves for something. So taking breaks without that sense of guilt is so very important, okay? To relieve oneself of a sense of guilt by taking a break that is needed, rewarding yourself without guilt. So how do you care for your well-being? Well, let's continue to talk about wellness. There is, many more, but we'll talk about 8 dimensions of wellness. On an emotional level, there is wellness. Intellectually, physically, financially, there is financial wellness. It's important. Social wellness, I mentioned already. Spiritual, environmental wellness. 2-3 days ago, where I was working, we didn't have any AC. We were not well. People were suffering here, could not do our work. Even patients could not come in and sit down in our office because it was just so hot. It was not well. Occupational wellness. Well, how satisfied or how content are you with what you are doing? These are some dimensions of wellness that one must take personal inventory to explore. Let's move on. Now, why is it important to prioritize yourself? If you take a look here, and I wish we were a bit more interactive, but just to gather, what do you get from this picture that I have here? You see the man, the older man, I don't know if it's father or cousin or whatever the person may represent, but the older man, who seems to be the guardian of the child, has their mask on, their oxygen mask on, and then afterwards will place it on the child. Well, what does that mean? That means that you have to look after yourself well enough so that you can look after another. Because let's say he places the mask on a child during some kind of tragic event taking place on the plane, God forbid, he may not have the strength to place it on himself. Then who's going to look after the child? That's why it is important for you to look after yourself so you can look after others. It is very, 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 very important. Further strategies for well-being. Well, I don't know about you, but at times the news before going to bed, it just so demoralizes me and makes me sad. And at times it makes me anxious. It makes me upset. And I have had to pull away from that and take a break from the news and maybe just watch something calming prior to going to sleep. So I've taken social media sabbaticals. I'd come back when things have changed. And if they haven't changed, then I may take a little bit of news here and there. All right. but these are just suggestions, strategies for our well-being. Social media, exploring our creativity. There are we have so many ways we can explore our creativity. If you think you're not creative, well, let me just correct you. You are, in terms of, as I mentioned, writing. Do you know, even putting on, for women, even putting on your makeup is an aspect of creativity. Okay, as I mentioned, writing, singing, whatever it is that propels you to do something different. Some people, it is cooking. Okay, exploring your creativity. You know, what are you good at? That's important. And then when you complete a task, you feel so proud that you have done this. This is, you know, you birthed something like this. Practicing gratitude. If you can think of 2 things at the end of the day that you are grateful for, let me tell you, that is very good as far as making you consider to meditate upon good things, practicing gratitude, making you, and it does calm the heart a bit and reduces anxiety. Maintain intimacy and connection safely, meaning continue to interact with those you are close with. Practicing smiling. There's not enough that can be said about the art or the practice of smiling, how it increases endorphins in the brain. It causes specific positive types of neurotransmitters to be released in the brain and makes you feel a whole lot better. Practicing smiling. I think it was Coco Chanel who said something to the effect of, nature gives you the face that you have when you're 20 or 30, but life gives you the face that you have when you're, 50 plus, because it's how you take life in, okay, how you appreciate life, so I wonder, how do you care for your own well-being? After all of this is said and done, you have to take a look again, personal inventory. Do you do these things? Do you not do these things? Practicing gratitude is a mighty powerful thing. Self-compassion, and I'm going to end it soon with self-compassion. I need to discuss this. What does this mean? It means it's extending kindness and understanding to yourself rather than harsh judgment. Remember that superego I spoke about? It's basically shutting that down and giving yourself some space, giving yourself some room, giving yourself some understanding that, you've gone through something. And it's okay to provide some of that compassion to yourself. Seeing your experiences as part of the larger human experience rather than as separating and isolating, which means that you have a sense of common humanity, that your bad experience right now is not just limited to you. Many people have gone through a whole bunch of things and seen that you're not the only one. And so, you're not like exceptionally bad. No, we're all human. Okay, so you extend a little forgiveness towards yourself. You're not alone in your funk. And then holding your painful thoughts and feelings in balanced awareness rather than over-identifying with them. That means that understand that you may be feeling bad or you may be feeling kind of harsh and negative, but understand that you can place those thoughts someplace, okay, and being aware of them as opposed to just having emotions that go with those negative thoughts. That is part of self-compassion, being kind to yourself. Self-compassion is absolutely not self-centeredness. It's not about being selfless, okay? It's not about being selfless. It's a matter of loving yourself, appreciating yourself. Cultivating self-compassion has been shown to stimulate brain activity that evokes empathy and compassion for others. So the more that you can give yourself a break, express kindness to yourself, will be more that you can do the same for others. As you help yourself, you're helping others, okay? This is scientifically shown through research, okay? Self-compassion is not self-centeredness. As you help yourself, you're helping others, and you can manifest that to others, and you can be a better therapist, a better physician, a better mom, a better social worker, a better anything and everything else. So we have to develop a self-care plan as we're ending, in terms of exercising within your capacity, of course. And there are many things that one can do as far as taking the stairs, as far as walking, parking a little further than where your job is, or taking walks. I mean, it's gotten warmer these days. In the evening, you can take a little walk if it's possible, wherever you may be. Nutrition, getting knowledge in terms of what is appropriate nutrition, what is not. Drinking water. I can't say enough about drinking water during the day. Men should aim to drink about 100 fluid ounces per day or 5 20-ounce bottles of water per day. Clearly, I'm preaching to myself because I don't do this as well as I should. I'll admit that to you. Women should aim to drink about 70 fluid ounces or 3.5 20-ounce bottles of water a day. Water is good for you. Very, very good. You help to lose weight. It helps you lose weight. It helps to good skincare. It's all good. And of course, getting adequate sleep is very important. Getting adequate sleep is very important. Knowing your limits, knowing that, hey, you know what, you can't function. Or maybe you can, but you can't function in 3-4 hours a day. All right. Understand, even individuals who have mania, bipolar disorder, one of the ways of treating that is by getting adequate sleep will help with that pathology, just by getting adequate sleep. Developing a self-care plan. Let's continue with that. Having creative endeavors, hobbies or activities, spiritual activities, however you may define that. Social support with friends, relatives. And this is very difficult in this time, in this day and age, in terms of having boundaries between our work and our home. There are times when I've worked from home and I'm dealing with people by doing televisits. And quite frankly, it's difficult because sometimes you don't know, well, once I stop with the visit, am I at work or am I at home? Does my life change as I cross this threshold? We have to really focus on establishing those boundaries very, very well. Some people have worked by getting up in the morning. If they're going to work from home, they put on some kind of work attire, at least the top part of themselves, and then afterwards just changing, just to let themselves know that, hey, I've crossed a boundary. I'm no longer at work. I am at home. But I know it's very, very difficult these days, but we have to be mindful of the need to establish those boundaries. And this is very important, and I cater to this. Have a vision for your life apart from the vision of whatever group or organization you belong to, which means that your story has to be your story, not someone else's story. You invest in your story. Certainly, you may align yourself with a group or organization or a church or whatever it is, and help them along the way. But understand, you really should have a sense of who you are and what your own personal goals, ambitions, and drives are, so that you're not just part of someone else's story, that you are your own story. Okay. And mindfulness, and we're going to end with mindfulness. Well, what is that? It basically essentially means being aware of your language, using positive or negative language, okay, not just for our patients, but also for ourselves. Thinking of yourself as your failure, your loser, you'll never make it. No, you're a success. You're a miracle. So being aware of the language that you use for yourself, and understand that hope is one of Shamsa's 10 guiding recovery principles. Hope allows you to wake up each day. Understand that hopelessness has a direct correlation with suicide, okay? Depression and suicide. So we can give or take away hope by the things we say to ourselves. These things have been proven based on research. And at this present time, hey, we've just made it 4:49. I am wondering if there are, I will end it on this note. I thank you once again for having given me the opportunity to share my thoughts with you and for being the keynote speaker. And I'll stop sharing and I'll check the chat, but
Thank you, Dr. Arty.
okay,
No
so
questions
this
in the
is
chat.
right on time.
No question in the chat. I'm not sure if anyone can raise their hands or they have any questions they want.
Maybe we can ask them to put their questions in the chat and you can read it off, Hildegarde, so that Dr. Arty can.
Yeah. Well, it seems that people have agreed with me. Yes, someone mentioned that they are very tired. Yes, yeah, you know what? I'm tired too. And these days, sometimes it's a little bit difficult for me to sleep, but I have to remember to look after myself because many people are depending on me, just the same way as I'm sure many, many people are depending on all of you. So please be mindful to look after yourselves. Thank you, Dennis Cuffey, on point presentation. I certainly appreciate that. Oh, there's a hand up. Kim has a hand up. I guess maybe Kim could be unmuted.
Are you able to unmute yourself?
Yeah, Kim raised the hand.
Are you able to unmute yourself, Kim?
She's not able to.
Or maybe that's just one hand clapping. I will take that.
Hi.
Hi, Kim.
Okay, I wasn't able to unmute myself before. I have a question. I don't cry at all. I understand I taught myself over the years to suppress a lot of things. And I find it very difficult to cry when any situation
I'm sorry,
happens.
Kim, can you lower either your laptop or computer or your phone, the volume on one device?
Yeah, better now? Yeah, better now?
Much better, thank you.
Okay, I've taught myself over the years to suppress a lot of my feelings and such. So I find it very difficult for me to cry in any situation that, okay, yes, I may halfway feel the sadness of whatever may be happening, but to cry, it is very hard for me. Is that natural, and how do I overcome that?
You know, thank you, Kim, for first of all, just asking a question like that, and for just, again, being transparent and sharing that with us. To answer a question like that, clearly, I would need to know you better in terms of understanding how you handle stress, how you handle trauma, how you handle the sadness. I think it's good that you're able to admit that you're not feeling well in terms of when you feel sad, you can acknowledge those emotions. The physiological manifestation of that as having to do with shedding tears, that's different for many different people. It's different. I wouldn't know at this point in our limited interaction if this is something that's just happening now, if this is long term, if this is, you know, in terms of modeling, and this in terms of how you've seen people express sadness. So there's a lot that would need to be explored. I will say that it's a good thing that you're able to acknowledge that you're not feeling well about it. And further than that, I would say it would be good to have, you know, further exploration about that. You know, how is it that you don't cry? Does it bother you that you don't cry? Have you ever cried before? I think this would leave me with more questions than can be answered right now in this presentation. But I will say this, I'm glad that at the very least, you're able to acknowledge that there are times that you are sad. How is it that you don't cry? That I'm not sure of. I think asking more questions about it would be, and getting the answers would be helpful. But consider how you have been from a young age. And when was the last time you cried, and what was that about? It leaves me with more questions than I have answers for you, unfortunately.
You have more comments? Great presentation. Can you discuss a little more about the high prevalence of mental illness among women?
Yes, I certainly can. You know, the question, the statement that I made was, I wonder if those, if the data is accurate. And the reason why I question the data has to do with culture. Here in the world, in the States, you hear things such as man up. You hear things such as, you know, boys don't cry. Clearly in the Caribbean, there's a certain idea of how a man should be, how a man should respond to stress, to trauma. And so, and even in the United States, so when you have surveys, when you have people who are working in mental health facilities, and you have much more women present there with complaints of, let's say, sadness or depression, or even anxiety, as opposed to men, you kind of wonder, is it because the men are not actually experiencing that, or maybe because they are not feeling released to express that, or is it seen as a weakness to express such thoughts, such experiences? And so I kind of wonder if that data is as accurate as that. Clearly, in this society, sexism goes about it. If the data is accurate, consider all the pressures women are, you know, have gone through and are still going through in terms of sexism, in terms of, let's say, many women raising children by themselves, a lot of trauma. And so culturally also, I think women may be prone to socialize maybe better than men in terms of getting together with a fellow, with a friend, a sister, whomever it is, and kind of share their feelings. I don't think men share their feelings as easily as, or at least been taught to share their feelings as easily, at least most men, as easily as women do. So I kind of question that data because I would have to put it within the cultural context, within the cultural context.
How do you find that balance in all that is going around us?
With great difficulty. It's, as I mentioned, it's a journey. I don't think anybody has arrived at that balance, but I think that when you understand yourself well enough to know what your triggers are, in terms of, if I watch television late at night and I'm watching the news and I'm reading and hearing all these things about voter suppression, and I'm reading about all this injustice taking place, and I know that that's upsetting me, well, maybe I best not experience that late in the evening, and I shut the TV down. If I know that I need 7 hours of sleep and I'm only sleeping, 4, then I know that I need to get better sleep, shut things down at a certain amount of time and just go to bed. If I know that substances, and we can spend another time speaking about substance use. If I know that drinking alcohol may not be the best for me at a particular time, or what it does to me may not be the healthiest thing, then I may have to be proactive in terms of curtailing that or adjusting that, or as we say in harm reduction, reducing that a bit. And the same goes with nutrition, with what we eat. So for example, me, I have come to find out that, having a little cereal at night does not help me in any way. I wake up in the morning, I feel bloated and I don't feel well. So I've had to just cut that out from me because I don't like that bloated feeling. So it's knowing who you are and what your temperament and what your triggers are and making adjustments to that. I think all of that will help in terms of achieving a sense of balance.
Thank you, Dr. Arty. Thank you. Thank you so much. Great presentation.
Thank you. And thank you for listening.
Dr. McLean, are you going to take us?
Dr. Arty, we are very grateful for such an informative and dynamic presentation. So thanks again. We appreciate you and we appreciate the presentation. Lots of takeaways, especially for me, the self-care. Because if you're not taking care of yourself, you're not available to take care of others.
Right. And you know what, Dr. McLean, you deserve it. You deserve to take care of yourself.
Exactly.
Don't feel bad. No guilt.
Exactly. Thanks again. We are now going to transition into our breakout groups.
Okay, good evening, everyone. I'm going to introduce my colleague and friend, Miss Alice Blair, and she's going to be speaking about sexual assault and domestic violence. Dr. Arty did an excellent job of discussing the issues facing mental health professionals and other professionals in the healthcare field, and the general effects of the pandemic on all of us, going through this situation for more than a year. Some of those effects have spilled over into the area of sexual assault and domestic violence, and this is what Alice Blair is going to be speaking about. Ms. Blair is an RN and family nurse practitioner. She's been an employee of New York City Health and Hospitals, Kings County since 1988. She began her career as a registered nurse in the Adult Emergency Department, a Level 1 trauma center. After completing her master's degree as an advanced practice nurse in 2003, she began working as a nurse practitioner in the fast track area until she took on her current role as a senior management consultant, which involves coordinating of the Brooklyn Sexual Assault Response Team, known as SART, for NYC Health and Hospitals. Ms. Blair is a member of the International Association of Forensic Nurses, American Association of Nurse Practitioners, and the American Association of Forensic Sciences. She's also a team member of the Brooklyn Sex Crimes Task Force. So we'd like to welcome Ms. Blair to begin her presentation. Thank you.
As Adele did such a great job of introducing me, It's an honor to be here this afternoon to speak to everyone. My topic can be sometimes depressing, but following Dr. Hardy presentation, it's just, I think, the topic to explain. During COVID, we did not see a decrease in the crime. We saw an increase, unfortunately, because more people was inside. So today I would like to just start by, Adele gave an introduction of what SART is. During my objectives are to define SART, explain how we take care of our patients from entrance to exit, what is chain of custody for all, healthcare providers, so they can understand when we have a patient, what is offered within health and hospital here at Kings, Woodhall, and Coney Island in Brooklyn for these patients, and how we work with law enforcement and what the examiners are doing. These are just other, up in the completion, we also will be able to identify a victim and how to offer them help. You can explain to, as a provider, how we protect a victim privacy from entrance to exit, describe what is evidence collection. I'll briefly go over signs and symptoms of strangulation, which is one of the biggest compasses that we encounter with domestic violence and sexual assault. Another major crossroads that we have right now is victims of trafficking, which has also shown a great increase with the pandemic. And I'll describe the resources available to assist with the victims of trafficking, provide resources with in the community and references. And the biggest and the ending will be about identifying safe discharge and follow-up for all the patients that we as providers encompass. This was already brought in, the SART program, which was launched in Brooklyn in June 1st of 2005, is a granted program by the Criminal Justice Center through the mayor's office. We are 11 hospitals strong throughout the city. So Brooklyn has 3 of the 11. Since the inception, we have had over 3,500 patients came through the Brooklyn program. And these are what we considered acute patients, which I'll also explain the difference between acute and post-acute. And this is how the other programs were started. Brooklyn was second to Bronx in 2004 and Queens and Manhattan in 2006. Here at Kings County, this is what the crisis center looks like. This is actual pictures of the crisis center. We are the example of what the city hopes to have a center in each hospital going forward. We were built back and opened back in 2006 with the new ER. It's a suite within itself, and these are all that we, when a patient comes in, this is the area that they are brought to and cared for within here. We are a safe center of excellence, 911 designated center. And as of 2020, we are also the certified skill lab, which is run by myself here at King's to do certification for new examiners. Every victim is treated with dignity and sensitivity. We offer emotional support. We work with the community-based organization plus our in-house psychiatry department to ensure that we have mental stability and offer mental hygiene to the patients. It's a private environment, and we'll go over every patient have a right to consent or to decline once they're brought here or present by themselves. So I was discussing what is SART, and the Sexual Assault Response Team is a victim-centered sensitive program. We're designed to provide a team approach responding to any survivor that present to one of our hospitals with acute sexual assault. In the state of New York, an acute sexual assault consists of an assault that takes place within 1 day to currently 4 days, which is 96 hours. We're moving towards 120 within probably the next year once the new kits are brought out by the state. All right, thank you. Our program, we're on call 24 hours a day, and we respond to, as I mentioned before, the 3 hospitals in the borough of Brooklyn.
Oh,
Hello?
Troy, please mute your line.
Me?
okay,
Not you, Alice.
Oh,
Somebody else.
okay.
okay. Are we good now? Hildegarde?
I think so, yes.
Okay. Okay. All right. So once an examiner responds to the hospital, their role is to meet with the victim, obtain consent, explain to a victim what their rights are. Even though all victims have an advocate with them, we are the providers, so we are the one going over the entire plan of care, seeking the patient consent and explaining all procedures. Conduct the forensic and physical exam. We start at the age of 13 and up in New York State. Those 13 and up patients are treated with or without parental consent in New York State. That will be discussed further. And as far as collection of evidence, we also do a second kit in many cases, which is the drug facilitated kit. Next slide. In order to become a safe in New York State, you could be a medical doctor, a registered nurse, midwife, nurse practitioner, physician assistant. And once you have one of those licenses, you complete an approved 40-hour didactic course, followed by the New York Safe training course program that I discussed before, that I showed you that we are now a safe center. You become certified, and with preceptorship and hands-on training, then you practice within the team. Next. Okay. That you could skip that. That's just the job titles that goes with what we do. It's, you know, we have the SAFE, which is a forensic, the medical exam, which is done in your emergency department. The police does the investigation. The social workers are your advocates and support for the survivors and the family. They provide all the resources to the community-based organization and for mental health, medication, and safety discharge. And the district attorneys are the prosecution base, where the cases are then forwarded to by the investigators for trial. Next. So sexual violence, which is what the umbrella that we practice under, can take many different forms, as I have it defined. And it's different in ways, but one thing remains the same no matter how we deal with it, whether we're getting a patient from a domestic violence situation, a sexual assault, whether it's interpersonal violence. It's all the same because it's never the victim's fault. That's the program. The entire program is geared towards giving back a patient, whether they're the victims, back their autonomy and self-control of their situation. No matter what the term is used, how the relationship is defined, it's never okay to engage in sexual activity without someone's consent. Next slide. The types of sexual violence. the term sexual violence is an all-encompassing non-legal term that refers to crimes like sexual assault, rape, and sexual abuse. There are often other crimes and forms of violence that arise jointly with crimes like sexual assault, and these are described as well. Those are the crimes that comes in with sexual assault and the domestic violence, the trafficking encompassing the child abuse. So those are, when I mentioned sexual assault is different from a rape, and a sexual abuse is different from a rape or a sexual assault. Next slide. The legal role of consent, which is the most important part of why we do the work we do. If we don't understand how consent works, that's a lot of times why we have patients filing charges, because consent is the most important. There's no single legal definition for consent. In each state, it's its own definition. This is something, when I looked it up, it's on the website. This comes from the foundation of RAIN, which is also cited. It's either in the law or through the court cases. In general, there are three main ways that states analyze consent in relationship to sexual acts. Affirmative consent: did the person express overt action or words indicating agreement for the sexual act? Freely given consent: was a consent offered of the person's own free will without being induced by fraud, coercion, violence, or threat of violence? Since one of the topics that I'll discuss throughout my presentation is the rape via drug facilitated, this is where we get the cases where we have, it's not violently threatened, but an individual will be given something to drink or, and lead into the coercion. But if someone uses a gun to threaten somebody, that is not a free will also. And the biggest is the capacity to consent. Then the individual have the capacity or legal ability to consent. And legal ability to consent, meaning that if you're incapacitated, you cannot consent. If you're a minor under the age of 17 in New York State, you're not legally able to consent to a sexual intercourse with anyone that is over the age of 18. So that again raises another barrier for us. Next slide. Under the law, this will tell you what constitutes sexual assault under the law in New York City. I can't speak for New Jersey. As I said, every jurisdiction, even across the bridge, have a different age and a different law as to what constitutes sexual assault. But the most common type of sexual assault is rape. It occurs upon any penetration, however slight, meaning that when we dealing with the vaginal area, any penetration, no matter how slight of the vaginal area, is considered a rape in New York State. So you don't have to have ejaculation. It could be digital penetration of the vaginal area. It's considered rape as long as the labia majora is spread apart in New York State. It's considered rape. There's just degrees of how that person would be charged, but that's what rape constitutes in New York State. Statutory rape in New York State, as I mentioned, anyone under the age of 17 cannot consent legally to have sex, but then the law is conflicting because we as examiners do evidence collection on victims starting at the age of 13 and are treated by us and does not require a parental consent. For those to clarify, when I'm in person, it's always easier. We follow the law of the reproductive laws in New York State that says from the age of 12, a child can walk in an emergency room and request STD medications or requests to be seen, and you cannot report it to their parents. So the sexual assault programs are guided by the reproductive laws of New York State. Next. And the next question that we have, if you come across as healthcare providers to someone that you meet that is a victim of sexual assault, these are the acts that we usually ask. The saying is that the victim body is our crime scene. Same if you had your car broken into the house, you would try to secure it. We ask that the body of someone who has been a victim is secured and brought to one of the safe centers as soon as possible after the assault, meaning there are all the, please do not change the clothes, don't shower. If you change the clothing, put them in a paper bag. Each piece of item is placed in a separate paper bag, not plastic bags. If you have 10 pieces of clothes and you have to change, bring in 10 paper bags with you. Family members, anyone, because it is documented how the clothing are received by the hospitals. If there are oral penetrations, drinking fluids is also not advisable. Urination, if there is suspect of drugs, even in a sexual assault with no condom, we always ask if you can do without voiding, don't void as well. And once you arrive at one of the centers, the examiners are on call. We are on call 24 hours, and an examiner will be activated via the emergency room to assist the patient from at that location. And they're expected by the DOH to arrive within 60 minutes of the patient arriving to the emergency room. Next. And this is what our logo in the cars look like. I just put a picture of that. Once we are on call, that is placed in our windshield once we arrive to the site. And that's where. Next. This is what a sexual assault evidence kit looks like on the outside. Inside of this kit, it has 15 steps. And every step does not have to be used. Every step is explained to the patient, and it's put everything that is in there is put back in, whether it's used or not. And the outside, it has the time, the person that opened the hospital. And this is what the evidence is collected in. All the swabs are placed back in there. And from us, if it's released to the police department, it goes on to the Office of Chief Medical Examiners, and that's who it's processed by. Next. This is the second kit that is done in when we have what's called a drug facilitated kit case, where someone can't remember or remembers as being at a location, waking up somewhere else. We do 2 tubes of blood and 100 cc's of urine, which is placed back in there. And it's also sent to the Office of Chief Medical Examiners, but to the drugs facilitator section where they process it. It's 2 different labs that processes the kits. This one is processed by the section that does bloods. Next. The next topic is domestic violence. And this is, most of our patients that we encounter is sexual assault / domestic violence. Domestic violence is prevalent. It's a controlling, next slide. It's a controlling, it does not have a face to it, but the most vulnerable that we have research have shown is your elderly, you have your children, people with disability, women, people of the LGBTQ population. We have a real increase in abuse in the domestics and in sexual assault. and immigrants. Next slide. This is just the tactics of abuse and physical abuse and violence. It shows you it's the will, the power and control, using coercion and threats, using intimidation, the emotional abuse. There we have one day that someone is beaten up, they come in for care. The next day they don't want to press charges. It's just the whole cycle of abuse and the power that we encounter. And in domestic violence, what makes it hard, that we are not mandated reporters for domestic violence unless there's children endangerment. So a lot of times it's frustrating. We come in, we'll do a kit, and the patient does not release any, and when it released, doesn't want police involvement. So we just have to offer her all, or him, all of the support in the community services that we can, in hopes of giving them the roadmap to getting the help that they need. Next slide. Elton Hospital as domestic violence programs across all hospitals. We are dedicated in the domestic violence, sexual assault, and child protective with elder abuse coordinators across the borough. Here at King's, we have the social worker, Miss Rose Mitchell, who is the domestic violence coordinator. Every hospital that you go within Health and Hospital, for the employees who are on, healthcare providers, there's always someone who can assist with finding resources for your patients across the diaspora of the cultures that we serve. Multicultural is really, really big. I am a big propensor of culture and sensitivity. When I do lectures, I've always push, if we don't understand the culture that we treat, then we're doing a disservice. In the community of here of East Flatbush, with Kings that we treat, I remember starting this program and being here, and we always had to be mindful when you say to somebody you're sending them over to psychiatry post the sexual assault, because they're saying to you, I am not crazy. So we have to take the culture and sensitivity into it and bring that back to, bring them back and explain that it's counseling and it's around what took place with them. We have interpreter services. As I said, advocacy is the big part. Those are all offered within the system wide and trained healthcare professional. Next. Strangulation is the key. This is just to show all healthcare providers, since this summit was basically for healthcare providers and showing us disparities. These are all tools that are available and out there that we can look for. This signs of symptoms of strangulation is readily available on the website, that somebody who treats patients in a clinic should always have and look at for signs of strangulation. What are the signs? If you're seeing subtle signs, blatant signs, and that's why it's there to just show. This is the biggest topic right now, but this didn't start yesterday. We have always had strangulation. It's just not been documented and, brought to the forefront with the victims. Okay. Hello? Hello?
We can hear you. Keep
I know
talking,
my
Natalie.
slide, I don't know who was sharing my slides. It went back to the beginning. So.
Oh dear.
I'm almost at the end and I'm now back at the beginning. So if we could just go to, the next slide. Okay, so this is the child signs of and symptoms of strangulation for healthcare providers. This is what we recommend, that is always readily available for someone to look at if you're doing pediatrics and in a clinic, or anywhere to always have those, you know, because it tells you where to look for your petechiae in the face, the eyelids, the ears, the mouth, the neck. So those are things that providers should be able to have readily available. And these are on the website, and the resources are at the end of my slide presentation as well. Next. And this is usually the resource that we give to the patient. These are all taken from the Alliance of Hope website. The facts that victims, we give them, and signs. If you notice, we have the word choking. It has it in parentheses because when you speak to your patients, they're not telling you they've been strangulated. They're telling you they've been choked. And in medical terminology, we know choking is different than strangulation, but the lay person does not differentiate. They know that something went around their neck and they could not breathe. Next. And this is the last form that we should have readily available. This is telling the healthcare provider what pathway, especially in an emergency department, should they take if the history contains certain markers of strangulation with loss of consciousness, urination versus loss of consciousness, whether we need to do more invasive procedures as far as CTAs and things. So this is more the provider pathway that should be also available. Next. And the last is human trafficking, which it's the last topic I'm doing, but it's the most prevalent that we have seen since COVID hit. I would say prior to COVID, we had 1 in 2 trafficking victims. During COVID, just to show you, most of our victims, if we did back in the days, 6 sexual assault kits with 6 drug facilitated per year, we did a lot, meaning the drug facilitated was not a lot. We found the drug facilitated since COVID has been such an increase, and most of our victims have been in the trafficking world where they're taken and used in the world of prostitution, which is trafficking, and sold as the pimp's property to other, for a lack of a better word, to other people, you know, in the community. So that's what my major role is, to try and stop human trafficking going forward. I've sit on the board for the task force now for the last 5 years, and Brooklyn has as the first human trafficking task force that is run with FBI and all the law enforcement that you can think of that is working to try and combat trafficking. Next slide. And this is what human trafficking looks like. It could be child abduction, forced prostitution, forced labor, forced marriages, organ theft, trafficking by boat, you know, anything that you can imagine that it's being happened current day. Next slide. This is the human traffic global data. So this number here is across the globe. So this was 2020. And it had that there was 108,613 individual cases in 164 countries and 175 different nationalities. So that's just to show you it's a global pandemic. Can we do the next slide, please? So this human trafficking marker here shows the United States. This is the number that is in the United States, and it's broken down into what areas are the most prevalent. And as you can see, prostitution makes up 46% of the trafficking victims. And New York City, believe it or not, is one of the most highly trafficked cities around the country. Prior to COVID, we were one of the hub for most of the trafficking coming in. So we work with the immigration services to actually try and combat it. And the numbers are miscellaneous, just could mean anything, but we do have the domestic servitude, which is most, domestic workers or anyone in a store. But as you see, as I said, prostitution, and that's where it crosses with my pathway of what we do as forensic examiners. Next slide. And this part is what we call safe discharge. Any patient that comes in here, whether it's human trafficking, sexual assault, domestic violence, it does not matter. The biggest and the only thing that we send is that we have a safe discharge. Social workers support the emergency department. We replace the clothing. We do safe return to the community. There's part of the laws by the state that the emergency rooms are obligated to do a safe transport back to home with transportation paid for by the emergency department. The social workers, we also have community-based spiritual guidance, and those are all in place in these programs. Next. And these are the resources where we can get help. The National Child Abuse Hotline is available anytime, 24 hours. We have, if you're a child abuse survivor of sexual assault, the National Sexual Assault Hotline, those are also numbers, and all these numbers are available 24 hours a day. The National Human Trafficking Hotline, I want to mention that. Anyone should take that number down. If you call the 1-888-373-7888 number any time of the day, it's not like reporting child abuse or anything. It's a number that if you call it, it's an anonymous, you could say to them, I think there's child abuse, there's trafficking taking place at 550 Clarkson Avenue. Any number that you give them, they will send somebody out to do their own investigation and look and see if they see activities that are suspicious, and that's how they combat that. So those are in languages of Spanish, English, and 200 more languages. They can prompt you to have that help. And those are the websites and the phone numbers that anyone can call or text. Next. This slide is from all the numbers that the Brooklyn District Attorney's Office offers. At the DA's office, downtown Brooklyn, there is a department for every services that we can think of. You have elder abuse, domestic abuse, human trafficking, public integrity, immigration affairs, labor fraud, teen dating violence, the Family Justice Center, which works with domestic violence and most violent cases, victim services, and 8 crimes. So those are all the numbers that if anyone wants, I can always pass it on and that can be shared.
Great, thank you so much, Alice. But if you have any questions, you can either raise your hand, put your hand up, or put something in the chat message and we'll address it. Could you just speak to the effect, Dr. Arty kind of laid the groundwork about what we've been going through over the last year and plus with this pandemic. You did mention the fact that you've seen the numbers going up in terms of trafficking. What's been the effect in terms of the COVID pandemic on sexual assault and domestic violence?
The effect was an increase. People thought there was a decrease. In the actual pandemic, we had a decrease in reporting, but we didn't have a decrease in the crime.
Okay.
Once the summer came, the summer for us literally started June, meaning that as soon as the weather increased, for the month of June, we tripled in the number of cases that we saw of 2020. We just had like outpouring of cases. I didn't put it in the slide because it was more, but just for 2020, people would think that we were in the pandemic, but from January of 2020 to December of 2020, we here at Kings County, when I say we, Kings County had 112 cases in that pandemic year. Then those were the people who reported, coming in. Because during April and March, the latter part of March and April and May, we were considered the hot zone of the ED. So luckily for the crisis center, which I showed, we were then placed as a cold zone, meaning that patients that were reporting were brought in, triaged, and then brought straight to the unit. But as we know, we were in a pandemic, and Dr. Arty actually made me stop and think, because vicarious trauma was what hit us. I became from a team of 10 at the beginning of the pandemic to a team of 2. It was myself and one other examiner that literally ran the program from January up until June, July. We were not able, because most of the examiners were seniors, retired, and some of them a few of them came down with COVID really early, the younger ones who were actually ill. And some of them had families that were really ill. One examiner lost like 2 family members. So it is really hard. COVID hit the whole city. And as healthcare providers, I think we didn't take that into consideration. This summit really made me stop and listen to Dr. Arty and said, wow, I didn't even think about it that hard. Like, it's time for us now to do self-care. But it did hit us.
Thank you for sharing that with us.
Hello.
Yes.
Yes.
I'm Jennifer Thompson. I signed in using my husband's computer. I tried to sign in on my own phone, but I could not. So where Capel Thompson's name is, it's actually Jennifer Thompson.
Okay.
Yeah, so here I am. I'll just show myself briefly.
Okay, thank you for joining.
You're welcome. Here I am.
Oh, thank you.
Okay.
What resources are there for, because the pandemic happened, right? And and I'm struggling to say this because it's very upsetting. There's been a huge increase of, sexual violence to young kids, right?
Right.
And as a father of a 6-year-old, it really disturbs me. So excuse me as I'm struggling to get this out of my system. What system is in place to help the most vulnerable amongst us? Because how can you protect a child from a parent, him or her, from their parents? Like how, like, like what is it that we could do in those situations?
I can tell you, since the pandemic hit, I mean, as I mentioned in my presentation, the role of these programs were to basically work with 13 and above. I have extended myself to literally work with the both pediatric department here at King's and at Woodhall. I have extended the services of my knowledge and my expertise to work. If I can save one child, I will do above and beyond. I have been involved in calling, if I have to call the police, the special victims to assist me to get a child. So it's just knowing your resources. If you know of a child, if you know of something, feel free to reach out to us and say something, because there is resources that I can reach out to. The other programs, every program has somebody in that is there. There's a child abuse here at Kings County. We have the child abuse task force, that takes care of that. We do have those resources. It's just that you have to know to just reach out. I know there's, with kids being home, we have had horrific cases of child abuse coming in. And I'm hoping I'm answering your question. If you need assistance or you know somebody who needs that assistance, feel free to call the operator. If you don't know any of the number, just call 245-3131, which is Kings County operator. Ask them to put you through to us. I will do my due diligence, because there's always somebody in call. If you just speak to them and say, how can we get help? I'll get you through to the pediatric department to get that resources out for you. But we, as a community, we have to work together, because we now have to become, I know it's a cliche, or brothers and sisters keepers, because it's a community need that we have.
Just a reminder, everybody, there's a link in the chat that you can access to complete the survey. So we would be grateful for your feedback, and our sincere apologies for the technical difficulties going into the breakout rooms. Thank you very much.
Thank you. Thank you, Claire. I trust that you had a very productive afternoon. Again, technology is good when it works and it works correctly. What the technician indicated to me was trying to put some people in their correct group, but they were not accepting to enter the group. So he could not move them over. So we apologize for that. We know that in this age of COVID, we are all struggling with technology. And trust me, it's going to get better. I want to take this opportunity to thank all of our presenters, Dr. Arty, Miss Blair, and Dr. Bob. We have learned so much this afternoon, and we want to assure you that the things that we have learned, that we are definitely going to be mindful of self-care, because if we are not taking care of ourselves, we wouldn't have anyone, we wouldn't be able to take care of anyone else. I also want to thank our community partners. I see My Time Inc. was here. I don't see them anymore, but we are grateful to you. We are grateful to BMS as well.
I'm still here.
Oh, you are still here. Wayne Clark from My Time Inc. We are grateful to you. We are grateful to Adele and Adele, help me with the
National Association of University Women.
Okay, the National Association of University Women. As you can expect, I'm going back and forth, so I can't even find my notes. So thank you very much, Adele. You've been a fantastic partner. We also want to thank TPA, and that is the Trinbago Progressive Association, for partnering with us. I hope you have benefited from this afternoon's program. Please remember to go to the chat and fill out the survey, because we want to know how we did. This is new to all of us, so we are learning as we go. So please be patient with us. Your feedback would be greatly appreciated. So on behalf of our team, our technicians as well, I say thank you very much. We owe all of you a debt of gratitude, because you could have been any place else. Now for next steps. We need you to let us know what it is you would like us to offer for next year's conference. We would like to see this as an international, the Caribbean Health Summit to be something international. As a matter of fact, today we have people from Trinidad, we have from Guyana, we have from Jamaica as well. So we'd like to see more people from the Caribbean region, and even more people right here in the US participating in this. So help us to get the word out. And the next very important activity that APC will be sponsoring is the Caribbean Heritage Celebration, which is going to be on June 24th. So we would appreciate if you can join us. What I would like you to do, if you can leave your email in the chat. Some of you, we have your email at registration, but not all of you registered. So please leave your email in the chat so that we can be in touch with you. Also,
Dr.
yes.
McLean, is on Zoom as well?
Yes, that's going to be virtually on Zoom as well. That is on the 24th of June. Come and let's celebrate the Caribbean culture. We are diverse, but at the same time, we can strengthen each other and learn from each other. So thanks again, everyone, to my board members, Ms. Claire Patterson for being the timekeeper, Ms. Hildegarde Reimers for introducing Dr. Arty, Adele for introducing Ms. Blair, Mr. Isaac for introducing Dr. Bob. Thank you very much. I also saw our board chair, Dr. Yvonne McCallum-Peters. She was in one of the groups. Dr. Peters, thanks for joining us. I did see our vice president as well, Dr. Naomi Mata, she was here. And all the people from all the different groups who participated. Thank you very much and have a great evening.
Thank you.
Thank you as well. Bye-bye.
Thank you.
Thank you.
Have a good
Bye-bye,
evening.
everyone.
Have a wonderful
Bye-bye.
evening. Bye.
Hey, bye-bye.
Okay, bye-bye. Please remember, leave your email in the chat so we can be in touch with you. And remember to fill out the questionnaire.
Where, how do you get the questionnaire?
It's in the chat.
Oh, in the chat, okay.
Yes, just go to the chat and fill out the questionnaire for us. Thank you, everyone. Appreciate you so much.
Thank you.
Love you, love you, love you.
Bye-bye.
Love you. Thanks
Thank
a
you.
million. Yes.